suicide prevention advocate. I mean, she's a survivor of, in fact, she's been a survivor of this very issue we talk about. So she has quite a lot of insight. I mean, she has personal experience in the issue, what we'll be discussing today. And I'm sure what she tells us, her view of it, perhaps should be what we should be carrying out there. And then I have another person who is also a suicide prevention advocate and also a survivor, but this time with a very unique story. And she's in the person of Ms. Karen de Silveira. And they are all here with us. So, well, I think I do have my moderator with us now, I keep saying doctor, I mean, Prof. Kwesi has joined us now, and he is going to be the moderator for this session. Prof. Kwesi is a consultant psychiatrist, and as we all know, he is the chief executive of the Mental Health Authority here in Ghana. Professor, you're welcome, sir.
Yes, thank you very much, Kwaku, and very good morning to you all, our distinguished panelists and our distinguished participants. I just realized we have 107 participants already, and I'm sure we are still counting. I'm sorry for being a little late. I had to wrap up from another program before joining in. I think I'm fine. Sorry, I'm advised that there was an echo, so I need to use this device. Yes, I hope it's better. Kwaku, is it better?
Yes, Prof. It's better now. Okay. Thank you. Thanks very much.
So I was just giving my apologies, and I sincerely apologize for my coming in late. But whatever it is, good morning to you all, and good day, depending on which part of the globe that you are there. And we welcome you all to this webinar. This is a sequel to the one that was recently organized in the month of September during the observation of World Suicide Prevention Day. Now, that day was observed with the theme working together to prevent suicide. And that had been a theme that had been running consecutively for 3 years. And rightly so, because we all needed to join hands to prevent the onset of suicide. Suicide has been on the rise globally and has been known to be among the leading causes of death, especially in the youth. However, we know that suicide is largely preventable if we understand the causes and what we need to do to prevent it. In Ghana, our laws continue to hold attempted suicide, or let's say suicidal behavior, as a crime. And this, we believe, is stifling the effort to reduce its occurrence, since talking about it and seeking appropriate help, rather than incarcerating persons who attempt suicide, that approach works better at reducing the occurrence. World Mental Health Day 2020 was celebrated 10th October, and we in Ghana, we use the whole month to celebrate it. And it was under the theme, Mental Health for All, Greater Investment, Greater Access. But in Ghana here, we decided to carve out a sub-theme from the same we mentioned as the power of the voice towards decriminalization of suicide behavior. Why did we choose it? Because as I said earlier, suicidal behavior continues to remain a crime on our status, and we thought that we need concerted effort to be able to change the status. Now, this was sustaining the advocacy on decriminalization of suicidal behavior. At this webinar, we have called together experts in various fields towards this objective. At our last meeting, which had a member of the legislature on board, we realized that the call to decriminalization is understood differently by various groups. And it's this understanding that we seek to put across so that together you will have a common understanding of what is it that we mean by let's decriminalize suicidal behavior. I was on a radio program some time back, and after almost 45 minutes, 1 hour of trying to explain why we need to decriminalize it and look at it as a medical problem, after I hung up, the host said, oh, Now, Dr. Say is saying that if anybody wants to kill himself, allow him or her to kill himself. So it was clear that I had probably spent the 1 hour or so explaining that 1 hour was totally useless, at least the host. The host himself did not appreciate the point that we put across. So we want to harmonize our understanding, because with that common understanding, then you'll be able to forge ahead. Now, to help us to do this, we have Dr. Eugene Dodoi, who has been introduced earlier as a consultant psychiatrist and a senior lecturer and head of the Department of Psychological Medicine and Mental Health, School of Medicine, University of Health and Allied Sciences. Dr. Dodoi has a huge interest in suicidal behavior and its prevention. And so no wonder at the last meeting, he was there and he's still here. Now, Dr. Charlotte Cuatrico, okay, my understanding is that as I came in late, my understanding is that all this introduction has been done. So let's move on straight ahead. So if we are all ready, let's take the first speaker, and that is Ms. Nama Adomboache. Nanama, we are happy to have you here. You are
very happy to be here.
And you'll be working together, and it's good to have you on such a seminar, one-on-one, being with you on the same, panel to be speaking to this issue. You share with us, we want you to share with us from where you are working in the United States, what it means to live in a country where suicide is not a crime, unlike ours where suicide is a crime. We want you to share with us your experience that you noticed there, and what difference do you see, and what effect does such an environment where suicidal behavior is decriminalized, what is the effect that will have on persons with suicide ideation? And therefore, in an environment where it's criminalized, what effect is it likely to have on them? So please take it and then let's hear from you.
Thanks so much for having me.
For the first round, let's keep really to 8 minutes. And also when you come in, you have another 70 minutes so that you'll be able to get the participants also to come across. Thank you.
Okay, yeah, thanks so much for having me. It's an honor to be here. Generally, the research shows that countries that not understand, because I believe across board we all understand it, but countries that acknowledge that suicide is a health issue are likely to decriminalize it, and then also are likely to provide the necessary resources that are needed to prevent it. Okay, so I live in Maryland in the United States, and across the United States, in all 50 states, suicide is not a crime. Each state has its own laws. However, across the all 50 states, suicide is not a crime. However, interestingly, in Maryland, where I live, and in another state, one other state, there is a clause in the laws that prescribes some form of punishment, okay? It's used sparingly, it's rarely used. However, what that punishment is that whenever it's used to say that the attempter of suicide should get treatment. So even in the 2 states where there's a clause that says there should be some punishment, the punishment is not jail, it's not a fine. The punishment says that you should get treatment. Okay, so it's clear that suicide is treated as a public health issue and not as a criminal offense. Okay, and because it's a public health issue and not a criminal offense, people are more open to talking about it. It's less stigmatized, and people are more likely to get help. Let's look at the media, for example. In print media, whenever a story is written about, a suicide case, at the end of the article, there's always a helpline. So just in case someone reading has suicide ideation or is suicidal, the person, right there and then has information to call to seek help. In addition to that, there are other media guidelines that are globally recognized, and because it's treated here as a public health issue, those guidelines are strictly adhered to. So the fact that it's the second leading cause of death among 15 to 29-year-olds globally, and also the 17th cause of death across board for all ages, means that any public health effort that aims at reducing mortality of any kind really needs to prioritize suicide. So wherever you are in the world, no matter the age group, if you're looking to reduce mortality across board, suicide prevention has to be a priority, specifically or particularly for the youth. Here in the United States, or here especially in Maryland, there are lots of suicide prevention campaigns that are ongoing. It's very common here in Maryland to walk in the hallways of middle schools, high schools, and universities and see flyers with suicide helplines and see, information about suicide on notice boards. So that's very, very common. In addition to that, several parent-teacher associations have partnerships with outside organizations that train, that do suicide prevention training. And so these organizations provide the teachers, not the teachers, the parents and students who are over the age of 13 with suicide prevention training. And in addition to that, because it's treated as a public health issue, it's really built into the system, the education system, and then the health system. So within the school system, this was in the last 20 years, I would say, several states have passed laws that require that in order to have your teacher's license, you have to go through a suicide prevention course. And for most of the courses, a minimum of 2 hours. So in some states, it's just a one-off thing. You need to do that in order to teach. In other states, you're required to take a course every year as part of your in-service training as a teacher. And this is mainly for public schools. And in one state, they've actually moved that further and said that even for private schools, that's New York City, in private schools, teachers are required to also receive suicide prevention training within the school system. And the State Board of Education or the state teacher certification boards are the governing bodies that determine the prevention courses that meet the requirements within their states. And actually in Maryland, they've gone beyond teachers and said that all school staff, all certified school staff should be trained in suicide prevention. One other intervention I wanted to mention is the fact that with COVID, as we all know, it's predicted that suicides will go up. And as part of the government's Coronavirus Relief Act, which is the CARES Act, suicide and mental health care is built in there. And to quote the president of the APA, he said, you can't have a healthy economy without healthy people, and that includes mental health. Okay, the mental health component of the stimulus bill that was passed by government aims to help the millions of Americans with existing mental illnesses or substance use disorders and the emerging mental health issues as a result of the COVID-19 pandemic. So in a country like America, where it's acknowledged and accepted and endorsed as a health issue, even the COVID stimulus bill factors in suicide, builds in mental health. In addition to that, government is finalizing a bill to establish a 3-digit suicide helpline. So currently we have a 1-800 number that's been used for decades now, but given that, we are expecting a rise in suicide cases, there is now a 3-digit number that's yet to be unveiled. It will be 988. It's been passed, and we're waiting for the president to sign it. And I know that in Ghana, there are suicide helplines. The Mental Health Authority has done a great job with that in collaboration with the Ghana Psychological Association. However, these are paid for lines. And hopefully when some funding kicks in Ghana, they can move to a toll-free system. Another thing that's being done here in the United States, because suicide is not criminalized and is purely a health issue, is that there are efforts to, the United States is making efforts to move towards universal screening. So when you go visit your primary care physician for a checkup, they can ask you if you have suicide ideation. If you happen to find yourself in the emergency room with a broken leg or with some other injury or some other illness, they are likely to ask you, or they should ask you if you're suicidal. So there's still efforts being made to push that. So that's still in the works. One issue that the US has though that Ghana doesn't have, thankfully, is well, good for Ghana, but not for the US, is the gun control problem. So although suicide is not criminalized, and although we have all of these preventive measures in place, because guns are very easy to access, people who are suicidal can easily get access to guns and then complete a suicide. And so although some countries that have decriminalized suicide have seen some successes in terms of a reduction in the rate of suicides, the US hasn't seen much success, primarily because of the gun control problem. And that's a political problem, and it's very difficult to address. But we're hoping that at some point that issue would be taken care of so that people who are suicidal would not have access to such a means of completing suicide. So generally speaking, people are more open to talking about suicide in the United States because one, is less stigmatized because it's not criminalized compared to Ghana, or even compared to the Ghanaian community here in the United States, because we take a lot of our leanings from Ghana. Thank you.
Thank you very much, Nanamba. You've been on time for us, and we've learned that it is less stigmatizing there where it's legal, and for all you care, without it, a lot of stigma would have been there, probably more than it is here, and the effect would have been more deleterious. We are happy to hear that. So let's move on to Dr. Eugene Dodoi. So what is the current situation in Ghana for the benefit of those who might want to know what is it in Ghana like? And from your psychiatrist point of view, what does decriminalizing suicide or suicidal behavior, what does it really mean to you? And what do you stand to achieve if we decriminalize it in Ghana?
Yeah, thank you very much for having me, and I believe we can all hear me. So the challenge we have in Ghana is that because of the criminal nature, there is actually no national statistics on suicidal behavior or suicide. And the minimal data we have is with the police or the criminal justice system, not in the health sector. That is where our challenge is. Yes, typically we know the elderly white male and the Asians, and Asians, these three countries, India, Japan, China, largely will die by suicide. And this is by statistics. So even though we do not have a national data as of now, there has been a very worrying trend where we see people, young people as young as 8 to 9 years dying by suicide. And then we see younger women in late teens to early 20s throwing themselves down a multi-story. Usually when women really want to die by suicide, they use a more peaceful means of death, less painful means of death. But if we are seeing Ghanaians young women using a violent means, like Nana mentioned, that guns are easily, so in the US, they die easily by gunshots and all that. But we do not have guns, and they go for a more violent means. This shows how desperate they were about what they thought was happening to them. Recently, we've had the Ghana Psychological Association come up with some study results that show that about 1 in 10 adults in rural communities think about taking their own lives. They found that about 3 in 10 junior high school students, this is JHS, have ever reported attempting suicide in the past 12 months. 2 out of 10 in senior high. So somehow it appears that junior high is, having more challenges. And then they went to the school for the deaf, where at that place they find about 1 in 10 report attempted suicide in the past 12 months. And I mean, there is a special group which probably we did not turn our attention to, the LGBT, where they find 2 out of 5, that is about 40% of them who identify themselves to be LGBT, either engage in deliberate self-harm or self-injurious, or these are all, I mean, people who are likely to die by suicide. The other, I mean, revealing one was the police officers, where 3 out of 10 police officers in urban Ghana report having suicidal thoughts in the previous 12 months. These police officers have access to guns, and we have had police death by suicide in this country. So when we talk about decriminalizing suicide, what we mean is that we do not punish people for having symptoms of an illness. That is, do not punish somebody for being sick. When we say we want to decriminalize suicide, that means that as a people, as a country, we are becoming progressive and not stuck in time. Because it means that we understand with the rest of the world that suicidal behavior is a symptom of an illness, and not because people are bad people. And that is what a crime suggests. Crime suggests that you have a bad mind, you're a bad person. Nobody deserves, I mean, to be punished for being ill. And in Ghana, apart from a symptom of suicidal behavior, no illness is punished. And this is just akin to like somebody having obesity and metabolic conditions like hypertension and diabetes, and you advise them to lose weight, and yet they are not losing the weight. So because they are not losing the weight, they should go to prison. Yes. That is how I mean, the whole thing is that because you are not losing your weight. So anybody who is obese, we find them on the streets, they are likely to die by heart attack. So let's jail them. And let's think of it. How did we get here? This is a law bequeathed to us by our colonial masters, and we codified it in 1960 in a criminal code. The same colonial masters in 1961 repealed that law. And it was a law for us because, I mean, the British colony and its, I mean, the British kingdom and its colonies believed that life belonged to the crown. So if anybody takes life of the crown, you are stealing from the crown. And that is why it was punishable, similar to murder. So murder or homicide, you steal another life, but suicide, you steal your own life. And that is why, so this is from how this one came about. And for us to have it in our law books after 60 years of independence, after 60 years of codifying this archaic law, I mean, we still have it and we have people punished. I mean, when we say we want to repeal this law, what it means is that we do not punish people, but instead we offer them treatments. Decriminalizing suicidal behavior means that, I mean, doctors can now state suicide as a cause of death. Currently, as it is now, it's a crime. And when people die from suicide, we can only write the cause of death to be death from unnatural cause. That means we lose data. We do not know who is dying by suicide, where they are, and all that. And by keeping this law and not repealing it, it means also that doctors are abetting crime. Because by law, if I see any patient with a gunshot wound, if I see any patient with a rape, I need to inform social welfare and I need to inform the police. So if this law remains, it means that every doctor sees somebody who admits being suicidal has a mandate or is duty bound to report to the police. So decriminalizing this law means that people who have been jailed, which I'm not too sure whether we can go back to time, but there have been people who have been jailed because they attempted suicide. Now these ex-convicts. So if these people are ex-convicts, it means there are so many things they can't do. If I have attempted suicide before, it also means that I cannot work as a doctor again. You cannot work as a lawyer, work as an accountant. You cannot do almost any government job. You cannot do many jobs because you are now an ex-convict. You are a criminal because you had symptoms of an illness. And lastly, I mean, if we do not repeal this and we do not have this second look about suicidal behavior, it's also relatives who died by suicide while serving. That's now. So the only crime in Ghana that when you complete
I think, Eugene, the network is not helping us here, and it's not getting through.
Okay,
But maybe you may, once you come on board, yes. Okay, so we take advantage and wrap up. Mm-hmm.
Okay, yes. So I was just saying lastly that it's not true that, I mean, suicidal behavior is the only crime that when you don't complete, it's a crime, but when you complete, it's no crime. And I'm saying that in the military, if you die by suicide, you are discharged dishonorably, and therefore you lose an entitlement to your survivors. Life insurance, I mean, if you have a life insurance, your survivors will not get any benefit because you died by suicide. And this cannot be allowed to stay when suicide is a preventable cause of death. Thank you.
So thank you very much. So the law criminalizes it, and the society also criminalizes your death. Once you are dead by suicide, through suicide, the society will criminalize it. The religious people will say you will not go to heaven. The military will say they will not bury you, and culturally, it's also tabooed. So good to hear all that. So now let's move into Dr. Charlotte Cuatrico. We know from what has been said earlier and all along that the laws in Ghana do say that it is a criminal behavior to attempt suicide. But how do you, as a legal practitioner, cum psychologist, how do you interpret this in your daily practice, particularly in your practice also as a clinical psychologist? And does it raise some conflict in your mind, and how do you deal with the conflict? So what's your take on all this? And you also have 8 minutes to give us your delivery.
Yeah, thank you, and thank you to the other panelists. As has been mentioned, section 57(2) of our criminal code, Act 29, criminalizes the attempt of suicide. And an attempt under our laws is what we'll refer to as an inchoate offense, meaning that it is an offense that has not been completed. And it is the only offense that you see in the act that only has the uncompleted part and not the completed part. So you have attempted murder, and then you also have the crime of murder. But here we only have the attempt, but not the completed one. And so it doesn't make criminological sense in that way. Again, you ask how I deal with it. In my practice as a clinician, I met one person, one young girl, about 14 or 15 years, who attempted suicide. She was walking along her corridor at home, and she saw a gallon of poison, and something told her to take it and drink, and so she also drank it. And so she was brought to the hospital. And at that time, I wasn't a lawyer. I was only acting as a clinical psychologist. So I had to take her through therapy to help her understand the options that she has to do cognitive restructuring and so on. Now, as in my current situation as both a lawyer and a clinician, there are ethics that guide both professions. And for both of them, the object is the well-being and welfare of my client or the person that I am seeing. And so for the legal profession ethical code, it says failure to defend client's interest. If you fail to defend a client's interest as a lawyer, you commit a misconduct, you know, and if he appears before court and you fail to uphold his interest to the best of your ability, it's deemed as a misconduct. And so the best interest of my client, who is suicidal at this point, is not criminalization or sending him or her to prison. It is about helping the person to find healing. As Dr. Dodoy mentioned, it is a symptom of an illness. So with my knowledge as a clinical psychologist and knowing that this happens, it is my duty as a lawyer to ensure that this person finds healing. And so my duty for both is to do what is right for my client at any point in time. And again, if you look at this, the statistics in Ghana for completed suicides, Osafo and others quote it as about 5 persons completing suicide a day. Well, backtrack. And it's also known that for every completed suicide, there are 20 more. So if there are 20 times 5 attempts each day, then how many people are we willing to incarcerate? Just think about it. It doesn't make economic sense to us. We already have an overburdened criminal justice system. And it's also been found that it is a symptom, it is a disease, it's something that is going on with the person. That is why the person attempts suicide. So diversion is the way to go. Diversion is the way to go. And so for me, as both a clinician and a lawyer, that is my, that is how I see it. And that's how I conceptualize the whole idea of suicide attempts being criminalized. Thank you.
Thank you very much, Doc. You brought that interesting dimension that if you are going to have so many people attempting and you are going to put them in jail, already you are depriving the whole nation, not only them, you are depriving us of our economic viability, our economic contribution. And so one person who you are putting in jail because he has a disease, you are putting many people there, depriving us of our economic viability. It certainly does not make economic sense. That's an interesting dimension that we brought, and I'm happy that you know that. So now, Ms. Favor Hilda Apini Brown, let's get to you. You are a survivor and a very strong advocate on decriminalizing suicide issues. And you've been through it all. So when we talk about decriminalizing suicide, what does it really mean to you? I know it can evoke a lot of emotions. Generally, what does it mean to you? Because you hear that, oh, suicide or suicidal behavior continues to be a crime in our law books. Does it give you hope that people are, together with you are trying to decriminalize it? Does it give you hope that maybe somewhere along the line, you will see the green light and things will change so that you'll be able to offer the help that is needed? What does it mean to you, and what hope does it give to you?
Thank you very much, Dr.
You may need to unmute.
Yeah, thank you very much, Prof. It means a lot to me. Hello, am I on? Hello?
Okay, maybe we are,
Yes, you are on. We can hear you.
we are not getting you here.
Okay.
So you come back to, let me go to the next one, we'll come back to Miss
Hello?
Karine da Silveira. Are you with us?
Yeah, I'm here. I'm here. Can you hear me?
Hello?
Hello. Hello. I can hear you. You can hear me? Yes. Okay. All
Yeah,
right.
Karen, I can hear you too.
Okay. Okay. Am I answering the same question as Miss Favor? Sorry.
Our moderator is off.
Hello.
Interesting. Okay, so I'm not sure what what Karen was going to be answering, but if Hilda is around, a favor, can you?
Yeah, I'm here.
Okay,
Yes,
so I can hear you too. So please go ahead.
yeah, wonderful.
Yeah. I was saying that for me, it's very sad and a situation that is unacceptable, like I always say. And I keep saying that the day this act will be repealed, I would add it to my birthday so that I can have 2 birthdays actually, because it will be the happiest day in my life as a Ghanaian. Because when I was in that situation, I realized that my country is not serving my best interests because I needed help, and all the country was ready to offer me was jail. This is very bad. It is very, it makes you even more depressed because you've gotten to a point where you feel hopeless. So as a citizen, you expect that, okay, this is the country that I belong to. And so if I am hopeless, this country should be offering me help. Then the country says that all I have for you is a sentence because I think that you are a criminal, you did it intentionally, you were. Meanwhile, the situation that, led the person to, or the circumstances under which I was, that made me take that action, I didn't even have control over. It's saddening because, sometimes it seems that, the whole country does not even understand what exactly suicide is. And as somebody who has gone through it, who has experienced it, I can tell you it is not something that anybody, would wish to go through at all. Because as a human being, your most valuable, asset is your life. So to get to a point where you are not in control of your whole thinking, and so you feel that they're the most valuable asset as a person, you can just let it go. That shows you the extent to which the person is in distress. And so if a person gets to that point where his or her most valuable asset, that is her own life, the person is ready to, just let it go through some kind of even a painful experience, and the country is offering jail instead of help, then it makes you feel, that as a citizen, this country, is it worth, living in? Is the country even worth dying for? Because I am in such a situation that I need my country to come to my aid. And then my country is telling me that what you did is criminal. So the best we can give to you is jail. No, it is not right. And it gives me a lot of pain, a lot of sadness. And even now, after over 10 years of having had that suicidal experience, and then now dealing with people who are going through similar situations like I, went through, it even makes it more difficult for me because I feel that the act is making our work difficult. Because if the person knows that if I come to tell you that I'm suicidal, you would probably report me or I will be stigmatized, then the person would have to stay back. in his own corner and then, probably end up doing it. Then, the statistics keeps, going up, because instead of offering help to those who need it, or giving them hope that if you come out to say it, you would get help instead of jail, we have left this law there. And it's like, it's become so difficult. We keep pushing, and it's not, we are not seeing so much green light, even though very recently we've had some green lights from people from parliament, and then, some of our authorities, which is, a little encouraging. I think that more needs to be done, and this law has to be repealed as soon as possible so that we can have a better Ghana. I have a dream that I always, say wherever I am, that I have a dream for a suicide-free Ghana. A suicide-free Ghana is not possible without the repeal of this act. Because if we want a suicide-free Ghana, then we have to allow people to freely talk about suicide. And people can only freely talk about suicide if it is decriminalized. If it is a criminal offense, why do I, talk about something that I know that someone can easily report me to an authority for? I need to report it when it is seen as a health problem. You see, people can easily discuss so that if the symptoms are shown by another person, the other people can even seek help on behalf of the person. But because of criminal nature that has increased stigma, it has made it difficult for people to discuss it. Me, for instance, at the time 10 years ago when I had my experience, luckily for me, because I was invited to the US by a friend, I was able to, get the knowledge that over there, it was seen as a health problem. After I had been reported in Ghana to the police that I had attempted suicide, when I got there, they were rather offering me help. So it kept me thinking. I was like, so what's wrong with our system here? These are people who I don't belong there. I was just there for a visit, but they saw me as a human being who was going through a mental health crisis at the time, and so they were offering me help. Then the country that I belong to, the place I work and pay taxes, the country that I have, grown to know at my own, that I expect to give me help, is rather offering me jail. It is sad. It doesn't give hope that we intend to give to people who are suicidal. It rather worsens the person's situation, because when the person wants to attempt the next one, then he or she would use a sure means of death, so that, I just go, so that you don't get me to arrest. So repealing this law, as a matter of fact, will give a lot of hope for treatment. It will give a lot of hope for people who are suicidal to seek for help. It will give a lot of hope to society in general to discuss suicide as a health problem. It will also give a lot of hope, to people that, yes, government prioritizes the human being than just, being judgmental and trying to punish someone for being in a distress. And for me, it would help a lot, and it will mean so much to every citizen of this country that, yes, I belong to a country where when I am in distress, they are ready to offer me help. They are not going to just jump, to conclude that because I felt suicidal, I am a criminal, or because I felt like dying, I am a criminal and I belong to jail. For me, it is not acceptable. And the day it will be repealed, then as a country, we would have been very fair to people who are suicidal, would have been fair to people who are mentally ill, we would have been fair to every citizen of this country, and shown that, yes, as a country, it is a country that, gives hope to the hopeless. It is a country that is able to help people who need help the most. Because at the point where someone is willingly ready to give up, the only asset, the best the most valuable assets as a person. That is the point where the person needs help the most. So jail is not an answer, and it will never be an answer to suicide in any human, terrain. And I think we need to act fast. We need to deal with this with all the urgency that it needs. The earlier, the better.
Wonderful. I like the point. Jail is not the answer. We
No.
need a better answer. And the better answer, as we are all advocating, is that let's repeal that part of the law that criminalizes attempted suicide. And after this, we'll go beyond that and also get to the military so that the religious leaders and the traditional leaders, so they all decriminalize even the completed suicide. Thank you very much. And then let's have a last panelist. And then I'll do some introductions of some of the participants that we have here. Ms. Karen de Silveira, you have also experienced some of these issues that we are talking about. So tell us about your story and how it could have been different if the laws were different as we have in Ghana. So please.
Okay, thank you for the opportunity. This is a very passionate thing. When it has to do with mental health, I'm very passionate about it because of my lived experience now. I was raped. Now, after going through that cycle and having been through what I went through, I knew what I was going to do. I had already prepared my suicide note already because I know I was prepared and I was determined to do what I wanted to do. Because, when you're raped, there's something that leaves you. I can explain it to you, but then until you are in that state for you to understand it. So when I was in that particular state, it was a difficult state for me. I had written a letter and I knew that was the last bit of it. So the timely intervention of one person I always give credit to, Bamidele Abeku Stevens, who saved me from doing that. Now, I was scarred. I was broken. So if in my state, you tell me that me being scarred, me being broken, you were going to take me to jail, trust me, if I got to jail, I would have ended it. I wouldn't be the Karen I am today. I wouldn't be where I am sitting and talking to everybody. It's something that it's about time we leave the 19th century ideology and think forward. I needed help, but one, I couldn't communicate. Rape is not something that when it happens to you, you can just go and knock on somebody's door and say, you know what, I've been raped. Because of how society sees that and the stigma that will come with it and all that. So I had to keep everything in. And I wasn't suicidal just once, 5 times. And in all instances, I could have. As you see, when you're in that state, if the right thing is not said, and you're not in the midst of the right people, anything can happen. The least mistake somebody makes and says something that is not supposed to be said will let you do something. And I wasn't the type who was very, sociable or something. I'm the type who keeps to myself a lot. So when there's something wrong with me, when you ask me, are you okay? I'll tell you yes. I can't communicate because sometimes when I talk to people, it feels that I'm speaking English and they're speaking Arabic. So I wouldn't even talk to you. I will go through it. So if in my state, I'm scared, I'm broken, and you tell me you're going to arrest me, I might as well do it. So it's about time. Let's all join hands to this fight. It's about time that law is repealed, honestly. Because if I go, we'd have lost a child to the land, we'd have lost a future leader. We would have lost, my mom would have lost a daughter, my dad would have lost a daughter, my brother would have lost a sister. Because I needed help and I couldn't speak it because the laws are too rigid to the extent that you can't speak up. Your voice is just within you. So, and let's be mindful of what we say to people who tell you, I am not okay. If anybody tells you I am not okay, see, spend like 1 minute, spend 2 minutes of your time and just speak to somebody. Say something positive. Do not brush it off if somebody tells you I'm not okay, because mostly the lively ones, people who are always bubbly, running around happy, they are people who are going through deep things.
Yeah.
And if you don't take care, they wouldn't tell you because you see them to be very happy all the time. And before you notice, oh, this person is gone. So please, it's about time. This is not the time to just say it, but let's join hands together and make the difference we seek. And I'm all for it to the day I die. I will fight till this law is repealed. Because we need to save, your children could be a victim, your sister could be a victim, your brother could be a victim, your father, your mother. Everybody could be a victim to this. So that's what I would say about that, please.
That's wonderful. Karen, you have hit the nail on the head. If you had been jailed, you would not have been here sitting and talking to us and sharing your experience. And we certainly need to keep our foot on the pedal of advocacy, of lobbying to make sure that this obnoxious law is repealed. Thank you very much. Before we move that we are here, we actually have 168, so I'll not be able to mention everybody's name, but let me just cite a few. We have Mr. Frank Safo of the Mental Health Authority. We have Dr. Erica Dixon, who is the immediate past president of the Ghana Psychological Association here. We have Dr. Pamela Iti. We have Dr. Dela Tiagbe and DSP Dr. Larry. We have Mr. Jibodi of the Mental Health Authority, Madam Ganyaglo, pharmacist at the Accra Psychiatric Hospital. Dr. Frank Banin is also here. Dr. Michelle Funk of WHO headquarters in Geneva. Welcome, Doc. She's also here. Dr. Sami Ohene, and I'll mention a few others as you move on. So we are through with this first round. I think the point has been made very clearly. We are all saying that jail is not the way forward, and criminalization is the way forward. We must see attempted suicide as a symptom of an underlying condition. Let's look at that underlying condition and help the person. In that case, let's look at the next, what is arising from that. I do the next round. So I come back to Ms. Nama Adumwache. So for the next 7 minutes or so, you are going to tell us what it is like, you having lived in Ghana and also being resident in the United States, where, as you told us, suicidal behavior is not a crime. Do you think a repeal of the law will have any effect on suicide? In other words, people are saying, and I must say, once you Parliament trying to, or when we were enacting the mental health law, and we had a point in it that that clause in the criminal code should be repealed. Not only did they say that, yes, there is already a law that criminalizes it, that much we understand. But the doctors there, in fact, amongst them, the doctors there were even saying that, no way, you can't decriminalize it. Otherwise, it means that more people will attempt. What is your take? Do you think if you decriminalize it, is likely to lead to more people attempting, or what? Nanama, what do you think?
So studies have shown that in some countries where suicide has been decriminalized, for the first maybe 2 years or so, it appeared, it wasn't the case though, it appeared as though suicides increased. But what actually happened was that because it was so stigmatized and because there was a lot of underreporting, as we already know. And so once that bridge was crossed, it was clear that decriminalization reduced suicide rates. And it wasn't just decriminalization. Decriminalization needs to be done in conjunction with having a comprehensive national suicide prevention strategy. So those are the two things that essentially some countries have used to combat or to see a decline in the suicide rate. And in Ghana, I mean, we, as Dr. Dodoy and other panelists have said, we already have our cultural issues, we have our religious issues, we have a lot of stigma already. What the law does is that it just further deepens the existing stigma that we already have. And what it does is that it drives more people to not seek help. It drives more people to not seek help. And one other thing I wanted to mention was even the way that culturally suicide victims are buried. They're not giving proper funerals, and we know funerals are a big thing in Ghana. They tend to be buried very, very quickly within a week. And in some Ghanaian subcultures, they're referred to as tofu. That's how I know it in Fanti. I don't know how it's said in other Ghanaian languages. So there's a lot of stigma already, and we don't need this law in addition to the stigma. And putting people in jail in the US, one of the risk factors, the well-studied risk factors for suicide is being in jail or coming out of jail immediately after you come out of jail. So being in jail in itself is a risk factor for suicide. And once you're released, at least in the US, studies show that people who leave jail for some months up to a year are at risk of attempting suicide. So we're taking someone who's already suicidal and has attempted suicide. And we also know that attempting suicide in itself is a risk factor for future attempts. So we're taking a risk factor and adding on another risk factor and saying that we're doing this to deter people from committing suicide. No, we're not. Or people from dying by suicide. No, we're not. We're rather increasing the risk by putting people who have attempted suicide in jail. There's one other thing that I wanted to, according to and I want to quote the International Association for Suicide Prevention. They came out with a statement in June 2020 as part of their position paper. It says that criminalization of attempted suicide undermines national and international suicide prevention efforts and impedes access among vulnerable individuals and groups to suicide prevention and mental health services. So that's the statement that they came out with this year, that there is prevention, but the law stands in the way, blocks the prevention of suicide. And that's a huge problem. And according to the same association, that's International Association for Suicide Prevention, currently 22 countries still have suicide in their law books. Okay, 22 countries have it in their law books. So out of the 195 countries in the world, or the 193 countries that make up the United Nations, 22 countries have it in their law books. So the question to ask Ghanaians, okay, Ghanaian citizens, I'm a citizen myself, is that do we want to be at the bottom 25? You know, we are the first country in Africa that gained independence. Do we want to be among the bottom 22? Sorry. And when you look at it in future, how do we want our future generations to see us? When you think of the fact that someone, you know, goes through trauma, and as a result of their trauma can attempt suicide, we as a country do not have good systems to protect people from the trauma of domestic violence, the trauma of child abuse, the trauma of rape. We don't have good response systems. Our response systems are so weak. And in addition to that, we also have a culture that silences people who've been through trauma, okay? So you go through trauma, which is one risk factor for suicide. The system does not prevent it. It doesn't protect you. It silences you. And then you develop an illness or you go through psychological distress, you attempt suicide. And this same system, this same country decides that we are also going to incarcerate you. That does not does not make any sense. And future generations will look back and see the advancement that we have in science right now in Ghana, the advancement in our government systems, the advancement in educational systems, the advancement in our law broadly, and look at this suicide law and say that what happened here? This is barbaric. So is that how we want our future generations to see us as barbaric? We don't protect people. And then we go on to incarcerate them when they're ill. Or we really want them to see us as being transformative. As in, we saw this law, we stood our ground and decided that in 2020 and beyond, we are going to push and press on to ensure that this is changed, because it does not, the science and the law do not meet. The science and the law do not meet, and it does not make any sense to have this in our laws at this time. So given that for a number of countries, the suicide rates have gone down, or they've seen some success post-decriminalization, and also with the implementation of a national suicide prevention strategy, I believe that Ghana would also see the same, as in once we decriminalize, it should reduce stigma to an extent. We know that there will still be some stigma, but reduce stigma to an extent, so that more and more people are able to talk about it and are able to seek the help that they need. Thank you.
Thank you very much. You've just told us that science and the law do not meet. They are running in opposite directions, and we need to find a way of them meeting. And one way to get them to meet in this matter is to repeal that law. Thank you very much. So let me now move on to Dr. Eugene Dodoe. But before that, let me say that in the chat box, we have some messages, and Dr. Pamela Nchi is saying that in fact, is emphasizing the fact that does be made that even our colonial masters who had it, or who taught us that attempting suicide is a crime, and they had it in their law books, they have repealed theirs in 1961. We still have ours, meaning that maybe we are saying we are wiser than them. It's possible, but is that so? The situation here, we need to look at that. Dr. Eugene Dodoe, now tell us, how do you prove to policymakers? We've talked a lot, but probably you may want to put this all together and find a way of putting it to policymakers so that you understand that repealing the law is the way forward and is going to be beneficial to the nation and will help you in particular as a practitioner, to achieve greater results as with a considerable reduction. You will need to attempt to convince them. So how do you go about that? So tell us, you have the floor.
Thank you very much. And I think that Manama has made very valid points. Some of them I was going to talk about, so I will skip those ones. And what I would say is that, I mean, the Constitution of Ghana, the 1992 Constitution, guarantees the right to health care. So we have a right to health care. So maybe we should ask the question, is mental health care part of health care? Which I believe it is. So if it is, why do we deny people of their fundamental human rights by criminalizing their sins? So actually by Parliament not repealing this law, they're actually going against the Constitution, and probably some of us should at charge that these are human rights issues that are being, trampled upon. Secondly, when I once had opportunity when the minority speaker spoke against decriminalizing suicide in Parliament, and I was going to the studio, and so to talk and explain why they should not be criminalized. And then the presenter asked me to bring people who have survived suicide, who have attempted suicide. And I said, if I bring them, can he guarantee me that the police will not pick them up? The answer was no, because if they go to the studio with me, they'll be confessing to a crime. And therefore the police was at liberty to go and arrest them. So probably Favor and Karen can still be, sent to court for confessing to a crime, supposedly, when they are sick. And you made a very important point about the human resources. So now Favor and Karen are contributing immensely to our human resource, to our productivity as a nation. But if they were penalized, then that means that they become, non-productive or very little productive. Largely, death by suicide now is considered a preventable cause of death. And just as, Nanama said, only a small minority of countries still have this criminalized. So the majority of countries who have achieved a lot of successes by preventing many deaths by suicide have decriminalized, suicidal behavior. So what makes Ghana different? Why do we think that what has not worked in the past, it being criminal, that the West have realized that no, it shouldn't be criminalized? Why do we think when we can go on that same path and achieve success? And like I said earlier, when doctors, when this is not, repealed, the doctors, can manage without feeling that they are abetting crime, And when, I think about 3-4 years ago, when we met with the judiciary, they actually understood the phenomenon of suicidal behavior and actually cautioned that or advised magistrates and judges that they should use their discretion not to punish these people, but rather refer them to mental health care. But should the human rights be discretional? I think it should not be. And we need this, as a matter of urgency. We have seen people like Karen and Favor who, after they have survived suicidal behavior, contributed immensely to our, to our society. So is there not enough evidence that, making a criminal behavior does not make any sense? It does not make any sense at all. It reduces productivity. And lastly, to add to it is that, yes, there are some part of suicides which are criminal. And these are largely suicide bombers. This is very rare in Ghana, if it has ever happened at all. I have no knowledge of it happening again. So why do we make a law that will punish the exception? And to affect the rule? It's like painting them with the whole, painting them with one brush. But as we all know, different folks with, different strokes. I think it's very important that we get parliamentarians to understand the phenomenon, just as the judiciary gave us that audience. And I must, commend the Chief Justice there. She actually sat in and listened and said that, yes, let's go to all others. So judiciary has understood it. Now Parliament needs to, and I think this current Parliament have about 3 more months or less to go. If they can get this done, this is just going to be a feather in their cap. And I pray and hope that this message will get to them and that we will start jubilating that Ghana is becoming progressive. We are forward thinking and understand the phenomenon of suicidal behavior. That is not bad people who kill themselves by suicide, but rather it's another thing. It's an illness that will make them want to die. Thank you.
Thank you very much. It will be a feather in the cap of the current parliament if they went ahead and repealed this law. Great. And you've also mentioned that it's only a minority, a small minority of suiciders who could well be said to be engaging in a criminal activity, like the suicide bombers. And why do you use a minority and make a law that binds the majority? That's perfect. That's good. So now, let's now look at Dr. Charlotte Cuatrico. As the law on suicide stands in Ghana now, and considering your dual representation as a lawyer and a clinical psychologist, what will you do if you are called in as a defense lawyer for someone who attempted suicide? You defend against the law, or you be on the side of the law till a repeal is seen? So, Doctor Charlotte, please you take the floor.
interesting question, and it's a hypothetical one. And so I'm going to respond as a hypothetical one with the laws that are already in existence, even without the repeal of Section 57.
I have a question.
Now, even in any criminal procedure, it is for the prosecution to prove its case against the defendant, and then that if there is a question to answer, then the defendant also begins his or her defense. So in this case, we are taking the person who has attempted suicide as the criminal defendant. So in this case, the law in Section 27 of Act 29, which is our criminal code, allows for a person who has, it's called the insanity defense. It allows for a person who does not understand the nature and consequence of his or her action, or is unfit because of what they call insane delusion to be a proper subject for punishment, to put in this defense. I will be arguing from the 27B due to insane delusion, unfit for punishment. And well, the law does not adequately define what insane delusion is, but our Mental Health Act puts the burden of proof of mental incapacity on the criminal defendant. So it means that you are criminally sane, you are mentally sane, or there's nothing wrong with you until there's proof that there is. And the law, Act 30, which is the Criminal Procedure Act, defines the process through which this what you call defense can come about. You can, I think they bring them to the psychiatrist or some other mental health practitioner to assess the person, to come up with what you call a decision as to whether the person at the time of committing the offense or was in the right frame of mind, or could not possibly understand the consequence of the action that he or she took. So that will be the point from which I'll be defending my client. Again, I will also use the data that we have, the data on suicide, which shows that it is actually an illness, a symptom of an illness. It's a symptom of a situation that is occurring with the person. In our context, it's been found that, contrary to what has been found in the other countries, that suicidal behavior is mainly based on biological factors. Ours is mostly based on social factors. So loss of a job, no money, and our sisters here related their experience, relationships gone bad, and so on. So for us, more of it is based on social issues. And so from research, I'll be coming from that angle to defend my client. So as a defense lawyer, that is what I can do for my client. And as Dr. Dodoy rightly pointed out, we had a training in 2017 for our judges, and most of them were eager to have this law scrapped. And in fact, even now, they divert them. We had one person mentioning that she had had someone come before her with attempted suicide and had actually asked the prosecutor to send the person to, what's the name, to get help. So even now, our judges are more in tune with what is going on, and also see attempted suicide not as a crime, but as a mental health problem that has to be dealt with. In fact, our law is now going a bit forward. If you look at Act 1019, which is the Narcotic Control Commission Act, that has recently been promulgated, you will realize that now substance use disorder, which is sometimes one of the avenues towards attempted suicide, is something that is now looked as a public health, public health problem, not as previously thought of as a crime. So whenever an addicted person is brought to the court will incarcerate them and so on and so forth. Now it is looked at as a public health problem, something that has to be treated with mental health position, or from a mental health position. So if we are to follow that trend of lawmaking, then it stands to reason that, one, as Dr. Dodoi has mentioned, there is an infringement on people's right to health if we continue with the criminalization of attempted suicide. And two, there has to be a reconceptualization of suicide attempt or suicidal behavior as a health problem. I believe the conceptualization of our law is not that it is a public health problem or a disease, but that it is a crime. But that there has to be a reconceptualization to shift it into that space, and that is what 1019 seeks to do. And I believe we can follow through with that. And with the promulgation of the Mental Health Act as well, I believe, and with all the mental health rights that are placed into that act, I believe it's time to move in that direction, and also possibly take a public interest case to the Supreme Court that this section 57(2) of Act 29 sins against the constitutional right to health. I believe that is something that will, as it were, ginger the system and and push it up into that space. And once the Supreme Court rules on it, it will be repealed. Okay, so that is one thing that we can look at. I believe the other angle is the diversion that we've talked about, that our judges now understand, but we need to continue to keep them abreast of the facts and the statistics as we have on the ground, and to constantly help them understand that it is an illness, it's a symptom of an illness, and it should not be criminalized, so that if even our police personnel bring them to court to prosecute, they will help them find another way of getting help instead of incarceration. Now, another point is this: if we are looking at diversion, then we need to have the institutions available that will contain the people that are diverted from the courts until a repeal is done. And even after a repeal, we need to have the institutions, we need to have the testing tools, the places, the rehabilitation facilities, and the personnel in place to ensure that they get the right amount of care that is required, so that they are helped in that way. And believe me, everyone or anyone can fall into this situation. I at a point in my own life, I had suicide ideation. So, and I believe most of us here have had suicide ideation. What stops us are different things, the resilience that we have, and so on and so forth, and the support that we get. So if we put that support in place, I believe our system will run better, and our people can have the help that they need, And we can also, as I mentioned, take a public interest case to the Supreme Court to ensure that this law is repealed. Thank you very much.
Wonderful, thank you very much. So as a last resort, we can take a public interest case. In fact, that is what India did. They had to go to court to get it repealed. We are very much hopeful that he will not get to that point. But if all these efforts don't help, then definitely you certainly need to get to that point. Thank you very much, Dr. Cuatrico. So, Favor, tell us, in terms when you, and by the way, as you said, many people would have. Hello, I think Adam Conva, if you could mute your mic, it would help us a lot. In fact, for every one case of completed suicide, about 10 would have attempted, and for every one attempted, about 10 would have planned. So that means for every one completed case, 100 would have planned or attempted. And for what everyone attempted, or everyone planned, 10 would have contemplated, and that means 1,000. And for everyone contemplated, one would have, well, had some ideation of some sort. So if you look at all those things, right from ideation to contemplation to planning to attempting to completing, for every one case that you complete, about 10,000 would have done it. And by the way, for every one case that is reported in our part of the environment, maybe 5 others would have got unreported. So you realize that many people, and indeed, if you have a group of 100 people and you ask them how many, as we just said, how many people have never had a thought of it, or how many people have ever had a thought, you see almost everybody raising their hand. So it's an issue that you need to seriously consider. So Favor, please come in. In times when you ever considered taking your life, did you know of any statute in the country that would make you, or that would make talking about it to anyone possibly send you to jail? And did this knowledge, if you had that knowledge, did this knowledge have any effect on your final decision to carry out your plan? So Favor, you take the floor and tell us in 5 minutes, 7 minutes, your thoughts on it. Sure.
Yeah, Prof. Hello.
Hello. Hello. Go ahead.
Yeah, my video is being blocked.
Oh, really?
Okay. Yeah, I think I'm on now.
Okay.
With my first attempt, I didn't know there was a law. Hello.
Yeah,
hello.
We are hearing you. We are hearing you. We can hear you. All right.
Okay.
I am big hacker and I hack into Zoom.
With my first
can you block everybody apart from Favor?
It's me. My
okay, technological crisis. I understand. Okay, you are pardoned. Okay, good. So Favor, please go ahead.
Yeah, I was saying that with my first attempt, I didn't know it was a criminal offense until the police came and said they were told that I had attempted suicide. Then after I got to know, it rather made my situation worse because now I knew that if I attempt and fail, then I may not be left to go again. So subsequently, I was now contemplating using a sure means of death because if I had to try again, then that means I had to, make sure I succeed so that I don't get sent to jail. So the law for me as a survivor or as someone who has been suicidal before is rather causing more harm than good. Because initially my attempt, I wanted help. And when I attempted and it didn't, succeed, if I had gotten the help at that time without the police coming in, no way I would even think of, doing it again, because I would have built my resilience, to face the challenges at the time. But because the police came in, and then I was now alerted that there was a law like that, then I was make sure that if I'm doing the next, one, then it has to be successful. Then, fortunately, I got this US trip, and then, I was taken through psychotherapy. Then I got, better, and then came down, and that led me to starting this advocacy. So for me, the law is causing more harm than good. There's no way that law can, stop someone. Like Karen said, if I had gotten to jail, I would have ended it, because, that would have been double tragedy. Already I'm going through so much. Then you send me to a place that I never, dreamt of going, because I have not committed any crime. You are going to cause me to just finish it. Or another side of it is that if I was taken to jail and I had probably even not completed it and come out, there's no way I would have gone into this advocacy, because I would have been bitter that the nation that was supposed to help me, rather put me to jail because of a situation that they have failed to address. You see, so it is not serving any positive purpose. Whoever, thinks that jail thing is preventing people from committing suicide, it's a big lie. A very big lie. The point that I got to jail was not enough punishment for the pain I was going through. All that was in my mind was getting rid of the pain. Having myself like I was before that circumstance came my way, or that situation came my way. So jail wasn't something that, I look at it and then I'm like, oh, okay, it is deterring me from taking this action. No, the pain was so overwhelming that jail would have rather made me do it. And that is what our policy, makers have to understand. When a person gets to a point that, the very life that makes you who you are, you no longer see it's relevant. You've lost all hope. Jail is no deterrent, no. And jail would rather make the person, instead of trying something that would help get somebody's attention to help you, the person will use a sure means of death, because I wouldn't try and fail and then end up in jail, because it's going to be double stigma. Suicide is stigmatizing enough. Ex-convict, another stigma. So at the end of the day, like, earlier presenter said, you have made the person's situation even worse than they were. So for me, the law is not serving the purpose that those who put it there think it is serving. And most of us who even attempt suicide don't even know there's a law like that. And even if we knew, it does not stop us from doing, taking such a decision, because it is the pain that is causing us. And the pain is far more than the jail term that is being talked about. So it should be help and not jail. Always help and never jail.
Great. So help and not jail. Always help and never jail. That is a take-home message. Thank you very much. Now, Karen, would you want to tell us, having on several times been through this experience, sometime back, what would be your message to our lawmakers and interpreters of the law in Ghana on the need for decriminalization of suicide, or the repeal of that law now and not later? What would be your message to them?
Okay, all right, thank you. First off, if suicide is decriminalized, now it will be recognized, suicide will now be recognized as a public health issue, thereby reducing the stigma attached to people who want to commit suicide, thereby making people want to seek help. when they are not okay. And the other thing is that it would give it will enhance the opportunity for effective suicide and interventions that will also reduce people from even getting to that point of wanting to complete the act. So I think that it's about time we recognize this as a public health issue. Just like when you have diabetes, you have hypertension, you go to the hospital to be treated, it has to be recognized as that so that we can seek help and save lives, because it's lives we are talking about. And these people are people who need help. So the laws are rather silencing them and letting them do what they think they are preventing from happening. So I would entreat our lawmakers that that act should be repealed, and they should know that people with mental health matter. They're also citizens of the land, and we need to offer them help as a society and not make them feel as though they are not part or they are outcasts in the society. So that's what I would say to that, please.
Definitely, if you want to make progress, we cannot continue to keep the law in our books as it is now. I think all the panelists have made very important points, and these points eventually get to the issue that we certainly will need to among the progressive countries which have decriminalized suicidal behavior. My technologist, is there any way that you can sort this out? So now let's open the floor to just about for 50 minutes. But before that, let me just, as part of it, there is Mr. Delali Fayose, a medical student from University of Health and Allied Science, medical school, who wants to be given a few minutes to make some submission. So please, Delali Fayose, go ahead if you are hearing me and make your presentation. Just 2 or 3 minutes.
Thank you, Prof. Thank you very much for the opportunity. I would like to say hello to a coach and mentor, Dr. Eugene Dodoy. He has been quite helpful in our mental health awareness campaign, which is going to be throughout the year. And from the medical students' perspective about decriminalization of suicide, we believe it's the way forward. I mean, for a normal human being, everybody would like to protect their lives. It's not normal human behavior to just be willing to give your life away just like that. And considering it from the perspective of why medical students would also intend, or even youth would want to consider suicide, would be one of the factors would be expectations. I mean, for medical students, you probably have had the best results and grades in basic school and secondary school, and then probably you don't see that in medical school, and family expectations and personal expectations might be something that will push you when you don't actually meet that mark that you want to, and then you end up being depressed. A research by one of our graduates, the first batch of doctors, Dr. Edem Atiso, shows that about a third of our medical students have mild to moderate depression. And that goes to show that the training process in itself is something that is a stressor. And we can also look at relationships as growing youth. I mean, it's something that most of us will experience, heartbreaks through relationships and all. It's something that has proven to be a stressor. So we believe we should consider suicide as a cry for help, and that anybody who actually thinks of actually committing suicide or even attempts committing suicide should be given the necessary aid. And actually, jail is not the best approach if we want to help people and make sure that suicide prevention is on the rise and suicide is actually going down. But then again, we can also look at the fact that how we view mental health issues are deeply rooted in both religion and our culture, and then would not only need to actually decriminalize suicide, but we also need to also make a community, provide a community that is more accepting of mental health issues and willing to talk about them, and not just relegate them to the background.
Wonderful. Thank you very much, Mr. Mr. Fayose. Thank you very much for that submission. And it's good to know, it's good statistics to know that 1/3 of medical students go through this crisis. And if you are to jail them, it means you are jailing 1/3 of medical students. That definitely is not the way forward.
Yes.
Good. Now we open it up. Anybody, I see Dr. Spencer, you have your hand up. Please take the floor.
Yes, Doc. I also, even though we are talking about suicide, I also know that some of us with mental health problems get homicidal. So I want to know why, like, we are not talking about that bit, or is it that like when we want to harm ourselves, we shouldn't be penalized for it, but then when we want to harm others and actually end up doing that, then that is a crime, so we have to be punished for it. And how can we be held? Because like me, for instance, from time to time, I have those feelings, and I don't know why I feel that sometimes, because after a while, when I remember that I was even feeling those things, I question myself, why should I be feeling that way? But then these are real, these are things that we go through. So how can we like manage all those things, and also in the face of the law?
Okay, if you have other hands or other persons, we can take 2 or 3 more and then we can take them together. Otherwise, we'll go ahead and answer this. So who wants to answer that? So 2 in 1. One part is that if I have a problem and I want to harm somebody else, if I have a problem and I want to harm myself, that one you take it up. What about, why are you not talking about if I want to harm others? That is 1. And 2, if I want to harm others or myself, is there any help that you can offer me? So 2 in 1. Would you want somebody want to take it up? Maybe Dr. Dodoy? Or else, anybody else? Any of the panelists? Dr. Charlotte Cuatrico? Okay, but basically, Doctors, the law already recognizes homicide as a crime, and we don't have any issue about that. But that same law that recognizes homicide as a crime also says that if anybody attempts any crime whatsoever, and there is a reason to be suspicious of his or her mental health, it should be taken for assessment. So let's say if I have depression and I'm suicidal, and that also makes me homicidal, want to kill somebody, and the law gets hold of me and they suspect I have a mental health issue, or my legal representatives recognize that I have a mental health issue, they will raise it up and the court will then send me for assessment. So for homicide is well taken care of. What has not been taken care of is what we are addressing now. If I have a suicidal ideation, the judge or the court is not mandated to recognize
Hey
that I have
guys,
a mental
welcome to my
health issue.
Minecraft Let's Play. Today we'll be mining diamonds and maybe we'll find some iron ore.
But this sensitization is what is bringing that awareness up. And you're also saying that if anybody attempts suicide, first let us suspect that he has an issue which needs to be addressed before we go with the prosecution. But I must also recognize that we have of Joy News post of news file here, and we are happy to have you here. Samiladi and Yenini, we are happy to have you here, and I'm sure that you'll be able to contribute 1 or 2 points to clarify some issues or address some questions that may come up. So yes, Nicholas Atariba, I have your hand up. Can you make a point, please? Nicholas Atariba,
thank
you have the floor.
Okay, thank you for the opportunity. I hope you can hear me, please.
Go ahead, please. Sure, we can hear you. Go ahead.
Okay. Okay. Mine is just a concern. This is an opportunity you have created that we those in the rural areas, we've gotten the opportunity to learn more from Mental Health Authority concerning suicide and the way forward towards decriminalization. I only hope that we get more opportunities. Mental Health Authority will organize more opportunities on the webinar like this, so that we will get more chances to learn on issues of mental health, because we those are the rural areas. We don't get visits from the Mental Health Authority. And the knowledge we learn from school, that is what we are using to practice here. And it's been a long time. We don't get trainings, no workshops. So my plea is that Mental Health Authority should do something about it. So at least this webinar is an opportunity for all of us to get the chance to learn on issues of mental health and conditions management, the way forward.
Okay.
So that's my.
Thank you very much.
Concern.
So that's a good intervention. Good point. I have some of my Charles. I'll come to you very shortly. I see your hand. I'll come to you shortly. But I have some of my directors here and my deputy chief executive, Dr. Caroline Amisa, and the director of administration, Mr. Vitus Pesese. They're all here. They are hearing you. So the point will be well considered. Come to you face to face and do some in-service training, and that's not just either or. This class also organizes more webinars, so we hear you. Yes, Mr. Charles Prempe, you have the floor, please.
Yes, Prof, thank you so much. I'm so grateful I've seen you, even though I'm far away in Cambridge. Yes.
Welcome.
Yeah, so I've really enjoyed the conversation because it unveils a lot of complexities with respect to the criminalization of.
Stop me from joining.
But I have a question. How do we rope in religion into the conversation? Because, I mean, about 85–90% of Ghanaians lay claim to religious affiliation. And many of these religions see life as God's creation and something that one cannot destroy. So how do we engage religious stakeholders? Not to re-theologize, but to carefully reflect that understanding of life and its termination, whether willfully or not. Because in my community, where in one of the Muslim areas, if you attempted suicide and you survived, you were ostracized, not just that, you were beaten. So how do we deal with that? Then the second one is a philosophical aspect, which of course also enters into the realm of the law. To what extent does the individual have right over his or her life? Our expert for the opportunity.
Okay, great. Any of the panelists wants to answer two parts. The first is the religious component. The religious people, from the religious angle, your life belongs to God. It doesn't belong to you. So if you do dare take it, then you'll be punished, either over there or here, and you'll be beaten. So how do you address this aspect? How do you bring the religious leaders into focus and discuss that? And then the philosophical aspect. Do I have any right to my life? If I have, why do you want to legislate against or on it? So that's also another aspect. So anybody wants to take it up? Mr. Lawrence Yemwa. Sorry. Yes, I saw a hand. But please, anybody wants to take
Okay. Let me respond to them. So, Eugene Dodoy, a psychiatrist. You see, the religious aspect, at least for now, serve as a protective factor for us, because many people who contemplate suicide usually will not do it because they believe it is haram or it is a sin. So by doing that, they may go to church for prayer, the demons will be cast out, or they will go to the imam and seek help. So from the religious aspect, yes, it protects against, suicide, but not every religion. Because when you look at the culture and religion of Japanese, in fact, that one encourages suicide. So for us in Ghana, the religion, the two dominant ones, Islam and Christianity, really protects against suicidal behavior. and which I think is a plus. And when we see them, we actually explore that avenue. And let's remember, it is not the faith of the practitioner; it's the faith of the patient or the client that is important here, not my faith. So whatever. So if your faith allows, kind of like protect you, I will explore and ensure that you are safe. The philosophical point, is that, to what right? So I think with that, we are zooming into euthanasia. When people feel that I have a right to my own life, and if I want to take it, I should. So in some countries in Europe, they allow euthanasia. But what we are saying is that we want the rule, not the exception. Majority of people who were suicidal, when they get better, no longer want to die. Unfortunately, death happens and we cannot bring you back. So if the person who is suicidal is allowed to die now, how can we know that months or years down the line, he or she would have preferred to live? Just as we have two, who are facilitators now. Okay, so if they were allowed to die, now they no longer want to die. So why do we want to accept that at the time they wanted to die, they were in the best frame of mind to die? And that is why we are saying that studies have shown that usually a diseased mind will prefer death over life. And the philosophical part does not really come in here. And I think that there have been ample studies and evidence to suggest that people naturally want to live, and not wanting to live is not the norm. And that is why we need an intervention for that. Thank you.
Yeah, thank you very much, Dr. Dodoe. Let me just add a little to that. So the point you are making, the religious component, let me start with that. Yes, all religions abhor suicide, agreed. In the same way, all religions abhor death. All religions would want you to live forever. All pastors want you to live forever. No pastor wants you to fall sick. So yes, it's good for them to encourage you not to fall sick, to encourage you to remain healthy. But if the inevitable happens and you fall sick, they should not stigmatize and criminalize your ill health. In the same way, we should all encourage people to stay alive, and we should not encourage anybody to want to take away his life. But if the inevitable happens, we should not criminalize the acts of attempting or succeeding. And that's the point that we're making. So yes, we encourage religious leaders to encourage their followers to stay healthy. And indeed, it's been said by one of the panelists that many people have contemplated, but a certain resilience on their part. They begin to look at a certain reason not to die, or because of my child. They are all strong points. But if in spite of that, the urge overcomes the urge to die, overcomes the urge to live, don't criminalize it. And that's the point that we made. And the philosophical point too, yes, you have your right to life, but to belong to a society. And as a society, we have all agreed to go by a certain social norm that we are all in the boat together. So even that same philosophy, you do not take away your life because you are abandoning the rest of this, philosophically speaking.
I think, Prof, that was one of the thought patterns that criminalize suicide in the first place. That we are in the same boat. Why do you want? We are all suffering. Why are you? Why are you in a hurry to leave the boat?
That's right. Yeah. So that is where the initial part of it. But as I said, if the inevitable goes further, you should recognize that which pushed you beyond the edge to be part of the society, and that is a crisis which needs to be supported instead of to be punished further. Yeah. It's like somebody standing at the edge of a cliff. Somebody standing at the edge of a cliff, and you challenge him that if you're a man, jump. Your challenge might push the person to go ahead and die. But if you recognize that probably some crisis has pushed him there, and you cajole, course, whatever it is, you can bring him back. And that's the point that Dr. Dodo is making, that who told you that he actually really absolutely wanted to die? If you're able to bring him back, you'll be grateful. Except that that same person may try again. Yeah, Mr. Yemwa, please go ahead and make your point.
Okay. Thank you very much, Prof. I think we have to be commended for this great opportunity for people to bring their views. I'm Dr. Lawrence Yamwa from Niche Science and Technology in the UK. Last October, I came with Bestel to Ghana.
Oh, okay,
and that's
okay, that's right, yeah, Bestel, sure.
Getting much interested in, yeah. So it's just a few comments, simple comments. One of the arguments that has to be put forward was arguing the case for decriminalization is that I think it should be pointed out that once you are in prison, the chances of committing suicide is even higher. And unless they put something to prevent that, people who have been jailed for it may then be pushed to the cliff of committing suicide. And we also have to think of the fact that 1 in 4 people have the chance of developing mental health. And there's a very fine line, even though we think we are okay. And if we think of it that way, then it means that a lot of the community in Ghana now have the chance, if not ourselves or our children or our nephews, we by putting the law there, we'll be pushing a lot more people in future to be having problems like that. And then we should also remember that the stigmatization after imprisonment could even lead a lot more people to want to go and commit more suicide. And the last point is that sometimes we need factual information, either for the legal people or for the people who the powers be, to see that, yes, it is time to make a change. And that means that we need a little bit of research, whether it's observatory research or something, to have the facts to tell the powers that be that this is what you need to look at to change your minds about the law that is happening. And we can get 37 or in our own prison or something who are also involved in these mental activities to be able to do that simple, small researches to have the facts to augment the case. Thank you very much.
Great, great. And that reminds me of the point that, just what you said, I think, Nanama, you made the point that already an attempt predisposes you or raises your chances of attempting subsequently. So somebody who has attempted has higher chances than the general population of attempting subsequently. And then you put him in jail. Jail itself raises the risk of a suicidal attempt. So it means you are giving this person double jeopardy. Charlotte, I'm moving into your territory. Forgive me. But you are putting this person into a double risk of suicide. 1, the very fact that he's attempted before, and 2, the very fact that you are jailing him. So if you really want to help this person, then jail should not be an option. Great. I don't see any hand up here. Is there any hand up again that okay.
Prof.
Yes,
Prof,
please. Dr. Cuatrico, go ahead, please.
Yes, please. There was a question in the about the philosophical thoughts concerning taking your own. I believe that argument falls in the ambit of euthanasia. You know, you know, helping you to die or to take your own life. And I think that is not what we are trying to say here. We are talking about someone who is mentally ill, who attempts to take their own life. And I think we should make that distinction and push forward this agenda to decriminalize that. Thank you.
Okay, that's great. Johannes Ekuonu, you have your hand up. Please take the floor. Johannes Ekuonu.
Yes, good afternoon.
Good afternoon.
Yes, it's just a little clarification. I would like to know the clear roadmap the health authority, the mental health authority and other stakeholders have designed in the course to decriminalize suicide in Ghana, and if there are specific timelines to it and yearly reviews or should I say monthly reviews or yearly reviews put in place to check and ensure they are on the path to decriminalizing suicide in Ghana. And so far, a couple of successes or failures chalked what you are doing in place of that, because I believe this conversation of decriminalizing suicide has been on the ground for quite some time now, and it's still conversation to me. I think I've heard from somewhere that a document has been submitted to Parliament and all, but we don't know what's going on with regards to a concrete action plan. So I'm asking if there is that action plan and a timeline to it, so that we can know where we've reached, where we are going, what needs to be done next and all. Thank you.
Okay, great. I think this question will obviously comes to me, and I'll take it. Yes, yesterday, for instance, we had a, well, do I call it sensitization workshop, where we had the Attorney General represented, we had the Minister of Health represented, and we discussed this issue and drew timelines, the roadmap of how to go about it. And we agreed that within 2 weeks, a memo would be submitted to the Minister of Health. Okay, so let me just give you the procedure of, and Dr. Cuatrico, you are here, you'll add or correct me. So the procedure we learned of repealing the law will be, you need a cabinet approval, and the Minister for Health will need to send a memo to cabinet to get the approval for the law to be repealed. Once you have the cabinet approval, cabinet approval for the repeal of the memo, then the Ministry of Health will again submit the appropriate documents to the Attorney General, including that line item of the repeal of the 57 section 2. And once that Attorney General has done that, then it just goes to Parliament, and the Parliament will late and go ahead. So initially, the most important thing is the memo that will go to the ministry, from the ministry to Attorney General, and that will be facilitated by the mental health authority. So together, you will submit a memo to the Attorney General and then, to the cabinet for cabinet approval for the repeal of the law. This is not an airline, it's the whole law itself. So you need the cabinet to approve. So this process we are taking into effect. When you have written that memo to the Ministry of Health, which they will submit to the cabinet, you will bring all the other stakeholders on board. And then from there, the various stakeholders that we need to sensitize, including Parliament, will need to be done. The repeal of the law does not lie exactly immediately or solely within the ambit of Parliament. Somebody will need to trigger it. It's cabinet, the executive, that will need to trigger it, and the Parliament will act on that. So, Dr. Cuatrico, what do you have to say to that, to the roadmap? You're muted if you want to talk. But otherwise, this is the roadmap. And indeed, FAVOR also, together with FAVOR, we went to see the parliamentarians, and the difficult points that they had against it, all those things have been softened. So I'm sure that the way has been paved. So it shouldn't be too difficult. The only obstacle we see now is the fact that we are going to have elections in the next 2 months. So all their attention, their focus might be on the elections. But otherwise, the way has been paved. So if you're not able to succeed, surely in the following year, I'm sure that we'll get the law repealed. All right, any other comments? Okay, so if we are done, yes, Dr. Pamela, you want to make a comment? Please go ahead. Dr. Nchi.
Hi, thank you for this afternoon's session. It's been really useful hearing everybody's expertise. And what's been really important to also gather is the experience of those who have gone through that process. And again, it would have been a significant life lost. It would have been a significant insight and expertise in our suicide prevention plans. What I wanted to mention, I've been hiding, here I am. what I wanted to mention is that we've spoken a lot about suicide in terms of the individual people. What we also know is that everyone's suicide affects, on average, about another 6 human beings. So it's not just about the person who's taking their own lives, but it's also the risk factor that presents to those who have been bereaved. So we know that as much as about 1 in 10 people who have been bereaved as a result of suicide, their risk for suicide is significantly increased. That could be as much as 65% of those people affected. So is then, if criminalization continues, does that mean that not only are we going to end up with people attempting suicide in prison, but also the other 1 in 10 bereaved by suicide, if it does continue, in prison? Does the Ghana government have an infrastructure plan to build more prisons to contain all these people? And furthermore, does the Ghana government then have the rehabilitation plan? Because that's what prison is supposed to be for, is it not? Rehabilitation. Does it have the plan to rehabilitate all those that it has incarcerated as a result of attempted suicide? If not, I propose that they look at potentially looking at decriminalizing, because it's probably going to be cheaper for them to decriminalize suicide than it will be to contain all the attempted suicides in their prisons. But I just wanted to bring the focus on suicide isn't just about the person that is taking their life. It's about the wider societal impact. It's about those who may be kind of bordering on a bit of an emotional or psychological ill health. And just hearing about suicides, and you know, I've been in Ghana at times and I've seen newspaper articles of people, you know, not necessarily suicide, but other incidents, and the graphic nature by which it's reported and the level of detail it's reported will leave vulnerable people essentially at risk of copycats. So when we look at this decriminalization, we have to also ensure that we are providing the expertise so that the infrastructure required to make sure that the people who are experiencing crisis are protected. Decriminalizing alone will not be enough. We need to make sure that the government commits to the resources required. That means making sure that the media is held to account in terms of sensible reporting. It has to make sure that the right level of resource is available to make sure prevention is kind of beefed up a bit, because there's no point waiting for people to take their life and then catch them and you know, deal with them. But actually, if we can prevent people, if we can address the context within which people live their lives, we are more likely to prevent more people wanting to take their life. The risk factors are everywhere. So, you know, our focus, yes, is on decriminalization, but there's a lot more that needs to be done. If Ghana is going to decriminalize, it has to kind of put its money where its mouth is and make sure that there is enough of a support around it to make sure that people who are in crisis are supported, and also to prevent people from getting to the point where they feel that taking their own life is the only option.
Wonderful. Thank you very much. I think that looks like a conclusion. You've summed it all up for us. So I think I can wrap up now. And then we've already spent some 2 hours, 20 minutes. And within this time, currently we have 127 participants, but we went to up to 168 within this period. So this has been very well patronized, notwithstanding the hitches that we've had. We have talked about suicide, that it is not a crime, but that a cry for help. Some may have been going through mental health issues, others other health issues, other social crisis issues. Whichever way, there is a need, there is a cry for help. And if you cannot help them, at least don't jail them. We've also learned that for every one case of completed suicide, about 100,000 would have moved through the continuum of ideation, contemplation, planning, attempting, or completion. And we need to recognize all this, that they have a crisis that we need to resolve, help them resolve. And for every one completed suicide, about 6 others are affected in one way or the other. Their dependents and others. In fact, if you come together, probably it's going to be about 10, 15 people. Not only your nuclear family, but your other dependents. And we need to recognize all that. And with all this, we say jailing is not the option. In fact, every case of jailing raises the risk of suicide raises to another level. The attempt itself raises the risk, and the jailing raises the risk. So it means you have double risk once you jail anybody. So we need to recognize this. And then the point that I want to make here as part of the summary, which is what just Dr. Nchin made, that after decriminalization, what next? It's not enough to decriminalize, but we want to make sure that you put in place the necessary structures that will give the support services so that those who have or who have ever thought or who wanted to go through that phenomenon will get the support they need. Because we know that every case of suicide, even though when they are, every case of attempted suicide, even though when you help them out, they are grateful, but they are likely to attempt again. And so you need to give the support. If you don't give the support, they may continue until eventually they succeed. So it's very important that you have the support services. And that also means that the Ministry of Health and the Ghana government must give the wherewithal to the various groups that are working towards reducing or working within mental health space and health space generally. So on that note, I want to thank you very much. I want to recognize a few others. We have our Deputy Chief Executive of the Mental Health Authority, Dr. Caroline Emerson joining us. I've mentioned Dr. Lawyer Ladi also joining us. And we want to thank you all very much. Zero speakers, 10 a.m. when you started in US, probably would have been much earlier, 3 a.m. or so. And you still managed to stay awake and join us tonight, Mado, and all the other contributors from various areas. Karina, your submission, given your personal experience, favor your personal experience, is really courageous on your part to be able to come out and say that, yes, you've gone through this and this is how what happened to us. We really appreciate that. And all the other speakers, thank you very much. And as you've all said, many people have said, that this should not be the last. We will continue to be having this these discussions, these webinars every now and then until the law is repealed. And even when it's repealed, we need to support ourselves that the necessary structures are given, that the government does what it's supposed to do in terms of providing the resources. On that note, I want to thank you and enjoy the rest of the day. Bye-bye.
Thank you.
Thank you very much.
Thank you very much.
You're
Thank
all
you.
welcome.
Thank you.
Welcome.
Bye-bye.
Thank you,
Welcome.
Prof.
Bye.
Thank you.
Bye.
Thank you.
Bye.
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 Bye. Bye. Bye.
Thank you, Prof. Bye-bye.
Welcome. Bye.
Thank you, Prof.
Thank you, Prof. Bye-bye.
Thank you, Prof.
Thank you very much, Prof.
Hi, Prof. I know that we've finished, but it would be nice if you can have a way of keeping this recording for future use.
Thanks, Doc. We will keep the recording. We do have it, and we keep all subsequent recordings, so we will do that. Thank you.
Great. Thank you very much.
Thank you, Favor. Thank you very much.
Thank you. Bye.